Hello, and welcome to today's webinar, Data-Driven Strategies to Enable Next Best Action in Healthcare. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Carissa Steinrei and Justin Scribbits. Carissa is Vice President of Clinical Strategy for Insighten Health, bringing more than 15 years of healthcare experience in both the delivery and payer markets to this role. With a background as a licensed clinical social worker and a passion for caring for others, she strongly believes in the connection between the member experience and healthcare outcomes. Justin is the Chief Marketing and Communications Officer for Parkland Community Health Plan. He joined Parkland in 2019 and has nearly 20 years of progressive leadership experience in Medicare and Medicaid. He holds an MBA and dual bachelor's degrees in marketing and multimedia. Before we go to our speakers, I would like to go ahead and launch a poll that will be appearing on the right-hand side of your screen. We'd like to know who is in our audience, and we appreciate your feedback. Please make sure you're not in full screen mode in order to participate in this poll that is appearing on the right side of your screen. And the poll reads, what is your role within your organization? And we have several choices. A, quality and stars. B, marketing. C, clinical care management. D, customer service. E, data analytics. And F, other. So go ahead and choose which is your role within this organization. And again, welcome and thank you for participating. And we'll go ahead and wrap that poll up just so we know who we are talking to today. And I will turn it over to our speakers now. Thank you so much.
Hi there. Thanks for the introduction. As mentioned, my name is Carissa Steinrei, and I'm with Insighten Health. And actually, prior to joining the team here at Insighten Health, about 2 years ago, I was a client or a customer of Insighten Health along with Justin. And so, really what I wanted to kind of kick this off by talking about is sort of what brings us to the healthcare industry space and really why Insighten Health is even sort of in existence to begin with. And one of the things that is so important is when you're working with individuals is having a really holistic view of that individual. So not just what is going on with them clinically speaking, but what else is happening in their lives, what might be going on from a social determinants of health perspective, what barriers might they be experiencing, but really seeing them as a whole person. And I think one of the things that our CEO and founder had noticed was that healthcare can be a very fragmented or siloed space. And thinking back to my health plan days, while I sat in clinical operations and someone else may have sat in the quality side, we weren't always privy to or seeing the same information. And so healthcare is unique in that while there is no shortage of data out there, it is often not connected or integrated in a way in which allows it to be meaningful. So really part of why we're in existence today is the team here has a real passion for bringing that data together in the simplest, easiest fashion possible so that you can really begin to get that holistic view of your population and of your individual members. And so that's really what we want to talk about today as part of this is how do we leverage technology and data to provide that holistic view and then drive kind of whatever that next best action for that member or population, what that may be. And so we're curious, there's another polling question that we'll go ahead and tee up to begin to understand what your experience of data is.
Thank you, and thank you for participating in the first poll. Our second poll is now up and running, and that reads, what is your biggest data barrier to delivering satisfaction to your members? Is it A, too much data, B, not enough data, C, data accessibility or clean data, or D, analytics and technology? So once again, we're curious as to what's your biggest data barrier to delivering satisfaction to your members. And once again, please make sure you're not in full screen mode in order to participate in the poll, which is appearing on the right-hand side of the screen. We do appreciate your feedback and your input because we really want to know who is in the audience today and what is your biggest data barrier to delivering your satisfaction to your members. So we'll go ahead and wait just a few moments and we'll close out that poll and our speakers will address the results. Again, thank you so much.
Great, thank you. It looks like we have a wide variety of folks on the call. A lot of folks in the data analytics space, a number of individuals in that clinical space. So that's great that we have that level of diversity here. And we'll talk more about what some of those barriers might be and how you can begin to sort of mitigate for some of those. So one of the things that you'll hear both Justin and I talk about is the way in which we have kind of began to think about healthcare from the perspective of other kind of mediums, so to speak. So right now you have Amazon, you have Netflix, Hulu, Prime, whatever you may use in that space that is very predictive in nature. So I travel a lot, and when I log into Netflix, they know what movie I want to watch before I haven't heard of it. I didn't even know it was out there, and it really that platform knows my preferences so well, or my buying preferences, and what actions I take, what I watch, so well that it is able to sort of suggest to me what I might want before I even know that. And that's really the idea of what we're trying to do here collectively together, is to begin to get to a place where healthcare looks more like that retail space. And when you think about what does that retail space have in common, is this idea of knowing that customer, thinking about members as customers even, but knowing that customer so well that you know what they want before they even realize it themselves, as the Steve Jobs quote says. So that is, it may feel like a lofty goal, but I think it's a worthy one, particularly in today's landscape when we all know that member experience is so important. Members have so many options to pick from, and why should they and would they want to work with your particular health plan? And so in a moment, you're going to hear Justin talk a little bit about how their company also leveraged some concepts from the Amazon world to drive what they're doing today. Really quickly, a little bit of background about Insight and Health. We have approximately 6 million lives in the platform, which equates to about 1 billion records. We're a SaaS platform and a cloud-based platform. And really, we endeavor to provide a very simple ability to connect with many data sources, push that information out to provide meaningful and effective insights, and then ultimately drive results. And we'll talk in a moment or two about some of the results that Justin and team have been seeing. And we do that via this idea of driving the next best action. And really what that means is looking at all of the information, whether that be clinical data, social determinants of health data, appeal and grievance complaint data, whatever that may be, to drive what is the next best individualized action for this person. So what does Carissa specifically want in terms of a next step, not just that kind of holistic cohort-like mentality. And so some of the things that we've done to really ensure that we are able to perform in that space is to seek out some certifications in the space of high trust. So making sure we're keeping data secure, working with a lot of thought leadership like Gartner, and then also becoming NCQA certified to make sure that we're just staying on top of all those industry standards. And so what does that really mean? And just, since we have Parkland here with us today, we wanted to talk a little bit about some of the work that we're doing with them, and I'll let Justin go into greater detail with this. But so we've been working with them as a health plan that's part of an integrated health system. And a big part of, I think, where we started was just simply pulling all of the data together. So aggregating all of those disparate data sources to ensure that they were really able to have streamlined and effective communication with their members. And then providing those insights that are not just compliant, but that are also really meaningful, and allow for effective and personalized member engagement, and ultimately having that sort of data informed next best action strategy. And so some of the outcomes that we saw that I'll let Justin talk more about is around resource optimization to drive up to about a 20% overall membership growth, aligning a whole lot of different touch points, whether those be internal or vendor based, so that they were able to have a really holistic view of what is going on with each individual member, and then driving that additional adoption internally to ensure that internal system was really aligned and all on the same page, and really kind of trying to get away from operating in those data silos. But Justin, why don't you talk a little bit more about some of that work, and then what you're doing kind of going forward?
Yeah, thanks, Chris. Hi, everybody. I'm Justin Skurbitz. Give a little bit of a personal background on me. So I've been in healthcare now for 20 years, and even longer if you go back to when I was a kid. I learned very early about health insurance, especially around the Medicaid space. I grew up in an environment where we didn't have a lot of resources available to us and our family, but I had grandparents who were very influential to me and worked in an insurance agency. So I spent a lot of summers stuffing envelopes, packets together. And that moment I realized that I was really beginning to understand that healthcare is unnecessarily complex. And so much of that is around the effort that we create for our customers. And through various tools like the Insight platform that focus on automation, can really take that effort down a notch and help our members focus on what's important to them. So for me, I started in customer service. This is where I got my thirst for the whole entire customer experience. I started talking to thousands and thousands of seniors in the Medicare product line. And one story that kind of still shapes my thoughts today was around a member who called in, an elderly lady who was going to be disenrolled for failure to pay her premium. And this was a while ago, right? So we didn't even have pay by phone capabilities. And when she called and told us why she couldn't pay her premium, it wasn't because of lack of money. It was because she couldn't get to her mailbox. Her legs hurt so bad that walk to her mailbox to get her bill was too much of an effort. And so that is where this whole entire experience really started to play point, and customizing, personalizing that experience and journey for each member became a passion. One of the things we were able to do to help this lady is we had a program where it was seniors helping seniors, people able to lend support. Through that program, we actually were able to connect her to another individual in her neighborhood that just swung by a couple days a week, brought her mail up to her door. That little bit of effort reduction really helped somebody personally keep their health insurance and focus on what was truly important, and that was their health. So for us, at Parkland Community Health Plan, the journey's been fantastic. We are now officially a year of having a complete plan that we brought in-house. We've been in existence now for over 20 years. However, all of those things had been managed by a third party of about 15 employees. And over the course of the last 2 years, we really changed the focus and vision and brought on leadership team that built out capabilities in-house, working with support vendor partners to have products to align what is now a community health plan that we are proud to say that we are heavily ingrained in the details to really get to know our members, understand the community needs, and help make a difference. So part of this implementation was with the organization Insight and bringing a tool for us to really manage those efforts, right? Health insurance plans for a while have been talking about abrasion and how many mailers they go out, how many phone calls someone gets. And this is something I've heard for probably a good 5-7 years. And to be honest, it got a little frustrating because it was the same thing you heard over and over. And the answer always seemed to be do less, which turned out to not be the right answer. It was, how do you get to the right conversation with your member, which might be sending a lot of extra touch points. However, to do that right, you needed to align everything that was happening in the organization and create a coherent conversation with your member that was meaningful, but at the same time, reduce the effort ask that you were putting on your members. This is the vision that we started out with our folks and working with Insight In. And for us internally at Parkland Community Health Plan, we put together, as Carissa mentioned, from Amazon. This actually came from a book, Good to Great. I'm sure many folks on the call have read that, seen it. But Amazon seemed to have perfected the flywheel concept, in which they simplified everything they're doing around their efforts to create a better customer experience. For us, we sought out to do that and focused around the brand customer experience, the BCX. That's what we call it and refer to it. Well, inside of that, we leveraged 4 focus areas, and those were insights, which was a way for us to build the culture of a customer first mentality inside of our organization and become that plan of choice by really understanding who our members are. We do this through not only research that we can talk about a little bit later on a slide, but also through just tracking things such as our brand. How many people recognize us, want to refer us? Secondly, is actions. These are the things that really represent our reputation of our organization. It's a way for us to facilitate, promote access, whether that's access to insurance, how to enroll, how to renew, access to resources, social terms of health resources, maybe it's value-added benefits, extras that you offer. And lastly, access to healthcare, how to go about getting that healthy living. Third is around those results. And this is where we played a key role with what we leveraged the tool at Insight In to be able to take and listen to our customers and actively respond to what they're telling us. And lastly, it's oversight. As Carissa mentioned, healthcare is very complex. There's many different areas. You don't want to get into a silo approach, and we always have that opportunity to do as we're moving so fast. So we've focused a lot of efforts around oversight, and we're doing this through actions such as having a committee that focuses on the customer experience. We take all aspects of anyone who creates any sort of touch point across our organization, whether it's directly to a member with a mailer, through a third party, maybe a behavioral health group that's calling our membership. All of these things are important in creating that unique journey that ultimately ties to the experience the customer has with you and your organization. And inside of that oversight that kind of mixes with the results, we also focus on a different lens at Parkland Community Health Plan. Revenue, membership, extremely important factors. We all can't deny that. However, we want to be judged on the impact we make in the community we live in. And by aligning with the assets we have across our organization, we're able to take the insights around the needs assessment of the community to the neighborhood census tract level to really identify opportunities to overcome inequality inside of those neighborhoods. And this could range from various situations such as poor air quality, in which we can tie folks to asthma resources to then get them to start responding to our campaigns that drive healthy actions. But it's the tie back to the impact of the community needs and how we've been able to see a neighborhood change from having poor air quality on their health to having higher health scores in that community based on accessing resources to those needs. Chris, I'm going to advance to the next slide here. As we talk about how we oversee these items, we really simplify it down to several categories that help us really focus that journey. So whether it's how we're attracting, bringing our awareness to the plan, all the way to onboarding, when somebody comes on board and we're thinking from that welcome kit to that HRA outreach, what's occurring, all the way through how we're retaining and recertifying our members through engagement and creating loyalty. These are the parts that we really boil all the actions that we do into and monitor those insights for the results at each of these stages. Now, it gets a little bit overwhelming when you think about the various types of members you have and their needs and their preferences. But that's where we've been able to kind of boil it down to how we're looking at our behavioral personas of our membership and matching that back to these various segmentations that are created inside of businesses. Whether you have a group of pregnant moms, children, demographics associated to each of them, needs to get folks into various health programs such as diabetes management. When you blend all of those things together with the behavioral personas, we've been able to utilize a tool with Insight to bring all of that as one, to start looking at this group of membership we have in a different manner that allows us to create more tailored content, a framework that allows us to really activate our audience through the right ways of reaching them, engaging them, but also connecting with them across their emotions in a way that establishes trust. With this different personas and how we engage our membership at these various pieces of things, we're creating programs that address those relevant barriers in a more one-to-one manner. And we do that through informing them, our members, with facts and resources. And we use those behavioral personas that we've recognized to motivate them, empower them, remove those efforts. And that has really helped us take what is always good intentions we have in health insurance and help move it to actions, changes. And across this whole entire framework that we use, we always are ensuring that we're providing positive care and service experiences across our organization, whether it's customer service, clinical services, might be our text messaging outreaches. All of these things need to line back to that positive experience, to the personalized outreach we're creating across those various personas. I wanted to just highlight an example here of what are some of the personas that we're talking about when we talk about these behavioral aspects of our membership. Well, for us as a Medicaid plan, we have two groups of primarily of our membership, and that is our pregnant mothers we serve and our children. In the state of Texas, we have to reach out to the parents for those children as they're the decision makers for them. And, it's through these conversations and actions that we know what we already know, that not every member is happy. But if we're understanding what those struggles are and identifying what the key features those groups are looking for, we bring that to life in all of our various outreaches that we occur. And the whole entire intent behind these behavioral sciences that are being applied is to use that data-driven approach from our learnings and act on these psychological insights across the organization. So Carissa, as we talk through behavioral personas, curious from an insight-in approach, as you've seen this and how we're organizing our outreach efforts, is there things that you're doing on your side to take this into action?
Yeah, there are, Justin. That's a great question. And just to back up even for a moment, one, I love these personas. What I love about the personas that you all are using is some of those attributes of a member who is grateful for having that health insurance, a member who may be having a frustrating experience. And what I love that you're doing, and you and I both come from sort of a similar background of that sort of boots on the ground type health plan. And what I love about what you're doing is a couple of things. That one, you use the word listen a number of times as you were talking. And so I think so often that, we can look at ourselves, myself included, as a subject matter expert and think kind of, oh, we know what is the right thing to do. And I recall from previously working with you that has always been something that has been important to you, and it is really important to Parkland as a health plan, is this idea of listening to your membership and allowing them to be the experts on themselves. And then that listening and that empowerment of that membership then really allows these personas to be, number one, so much more accurate, but also number two, so much more powerful, because everyone is kind of coming from that shared experience or that shared perspective. And so just wanted to acknowledge that I love that approach, and I love how personalized it is, and I really appreciate that idea of listening. And in terms of kind of where we're going from a persona perspective, I feel like sometimes that can be somewhat of a dirty word or a misnomer. So as we talk about hyper personalization, well, then are you just going to bucket me into a persona? But one of the things that I think we've started to notice here at Insighten is that we may be asking members for feedback, but there's only a small cohort of your population that may be giving that feedback back to you. So first off, just really beginning to look at communication preferences to say, how did this person join the plan? Did they go online? Did they meet face-to-face with a broker? So that all of our interactions throughout that life cycle can be really within that person's preference, so that you are getting that feedback, and so that you're able to use that in a meaningful way. But then, because of kind of having that analytics background, and because we do have the power of data, I may not be telling Netflix I want to watch this movie, but they know that I do. And so really what we're doing in this space is we're looking at, okay, so you've got health plans who are doing outreach. In Medicare Advantage, it's the CAP survey, and in different lines of business, it's different types of polling. But you're sending out these questions, these surveys to members, asking them about their experience. And typically response rates are around 30%. Well, taking a look at that 30% and applying some AI learnings to that, and really looking at, what does that individual look like? What are their communication preferences? What are their healthcare needs? What are their barriers? What is their geography, zip code? And starting to look at, well, hey, there's another piece of the population that really looks very similar to those respondents. How might we be able to anticipate their needs? So if you have Justin who belongs to a particular provider group, and you may be polling your membership about their experience with that provider group, you can begin to make some assumptions that if Justin says, hey, it is really, every time I go there, I have a really long wait time. When I'm seeing they don't have my test results, they don't have the information that they need to make this a meaningful experience for me. and you come to realize that there are other people who kind of look similar and are perhaps going to that provider, you can start to begin to kind of proactively address some of those barriers before someone else even has to experience that. So looking at that and saying, what might that mean? What might that mean for the provider? What might that mean for us as a health plan in terms of what sort of resources or education we want to offer, to make sure that the next person has a more positive experience. So we're doing a lot of work from a persona perspective of looking at what do we know, so an active problem or an active gap, as we call it, and who might we infer is very likely to experience that same scenario, and how do we get ahead of that? How do we put something in place to ensure that we're really mitigating for that before it even becomes a problem? So I'll pause there and see what you may add in terms of what your plan is doing, specifically to kind of proactively address some of those types of barriers.
Yeah, and bringing that into, real world of what we're doing every day. I'll start with the flywheel that we mentioned earlier. And, the whole intent of that flywheel is a way for us to have the effects of what happens when those small wins in our business occur and build on each other. And that example of the small win that comes to mind when you talk about using those personas to tie into those needs. I mean, we have about 230,000 members in our plan. And we see about 500 voluntarily disenroll each month. And there's numerous reasons, but when you look at those personas and the data that we have, we were able to identify and understand that we were not meeting their needs. And what does that mean? Well, you talk about 500 folks, it was different for each one, right? Everybody has different needs. But we use those personas and our data available to drive custom campaigns out to them that we optimally hoped were meeting those needs. And this is one of those pieces of information that we looked at and started those campaigns and now monitor. And those small wins of us actively reaching out to those 500 to keep them in our organization don't have the final results as share of that. But let's say it's 10% of them. That's simple, small things that we're doing to make a tiny impact. Now, when we actually look at those results and they come back even higher, we're going to be very delighted and excited and look to kind of enhance that program even further. But those are the small little wins that add up, because it's very hard to change the whole organization as a whole. But it's easy to have small wins, especially when they're focused. So some of those other additional efforts that we're applying these things to, wanted to just highlight this across what we're doing with onboarding, retention, recertification. These are all the various campaigns, outreaches we do where we're applying these various personas and data communication strategies. It's a highlight of where we've begun and started. And as we grow as an organization that's become more mature with the new leadership capabilities, we look to expand this to even more outreach and aspects we can do. So I think on the next slide, we were going to look at doing another polling question and
Thank
start
you.
to hear from the audience.
Thank you. As you can see appearing on the right-hand side of your screen, we have one more polling question for you. Make sure you're not in full screen mode in order to participate in the poll, and we do appreciate your feedback. And this poll reads, how advanced are your data analytics as it relates to your member population today? And there are four choices. Is it very advanced, A, B, somewhat advanced, C, not advanced, or D, haven't started? So, of those four choices, what best suits how you would describe how advanced your data analytics are as it relates to your member population today? And once again, we appreciate your feedback. And again, to participate, make sure you're not in full screen mode so you can see the poll pop up on the right hand side of your screen. Very advanced, somewhat advanced, not advanced, or haven't started. I'll leave that open for another few seconds while we take all of your responses, and we appreciate them. And I'll go ahead and finish it up and turn the results over to our speakers so that they can discuss. Thank you.
Yeah, so I'm watching the results as they come in, and it's really interesting to see. I think we have a lot of folks who are showing as somewhat advanced, and I'd like to just talk a little bit more and ask Justin some questions that sort of combine the last two poll questions. So first, we talked about what is the barrier from a data perspective in terms of delivering satisfaction to members. And then where do you feel like you're at from an organizational perspective in terms of how it relates to your population today and the interventions that you're doing. And so it looks like from a access to data perspective, a lot of what we're seeing is data accessibility issues. And I can certainly relate to that from a health plan perspective of having this knowledge and sort of knowing that there is a whole world of IT and analytics out there that has all of this information. But me as a clinician or a social worker talking with those members didn't always have access to that. And so knowing this is all out there in the universe, but the person who is going to be having those interactions maybe doesn't have access to that data. And then seeing that most folks on the phone feel like they're on their way there, but not quite there yet. Justin, I'd just like to hear from you in terms of how you feel things are going with your plan in terms of your own access to data, and then what that allows you to do from an advancement or from an advancement perspective to kind of make things better and to make that interaction better. Because what I think is unique about your population that is going to continue to become more and more important is that it seems like you all do a lot of community-based work. And, historically, I feel like that is where I have often thought, gee, I may have a care manager from a health plan reaching out to Justin, and Justin has no idea who Carissa is that's calling. But boy, you have somebody from the area agency of aging coming to your house every other week, and that's somebody you trust and you have a great relationship with. How wonderful would it be to be able to glean insights from those interactions and allow that person with whom you're comfortable to sort of drive that? So would be curious to hear, and I'll do what I say is so important and listen, but I'd be curious to hear how you feel in terms of access to data and where you're at and what that's allowed you to do from an innovation perspective.
Yeah, as far as access to data, we actually have been in a fortunate situation where we're very data rich, but also easily accessible to that information. And when I talk about that, we actually have an innovation center inside of Parkland Health System that we work closely with, who really focuses on the social determinants of health inside of the community needs. Through their efforts, they're identifying not only community partners, but what are the core needs inside of that neighborhood. So that insight is able to be carried forward to align to our membership. So not only are we receiving information around, Carissa Smith and where you live, but now we're able to tie what are the needs inside of that community. Who are those agencies or partners? So when we begin our outreach, sometimes it's kind of hard to even ask somebody to take an HRA if they're unable to access food, get transportation to pick up a medicine. We need to connect them to those resources first. And by that alignment with those organizations and identifications, we're able to track through our tools of who we're sending referrals to, what those referrals are following up with, who's engaged, to help those members progress across that journey we anticipate them to have to then engage with their health. So for our membership and access to data, the largest amount of folks who are engaging with us as a health plan are actually first engaging with us as an access to resources plan. From a marketing perspective, it's always been about brand and demand. And so when we started to get very passionate into the community base and wanting to make that difference, those basic marketing aspects around awareness and driving next best action for our demand functions became something that when we looked at how to make an impact on the community, we knew our area could definitely step right in and help contribute to this. That alignment across the organization is what's made it successful for us. I think we were going to take a couple of questions from the audience.
Yes, thank you. At this time, we are going to address some questions that have come in during the presentation. We have several that have come in, so we'll jump right in. Our first question reads, when you think about important metrics around the work you are doing, what are the top 3 to 5, and what do they mean to you?
Yeah, again, from a plan perspective, when I look at those metrics, of the most important aspect to us, we do look at satisfaction, which is being measured across various pieces of the organization and then compiled through our oversight areas. We have satisfaction from a quality lens, satisfaction from a marketing lens, satisfaction from a customer service lens. Bringing all those things together helps us keep that pulse and aligning that back to our brand tracker as an overall gauge of, are we making an impact, an inroad to not only familiarity or recommendation, but also how likely they are satisfied, which is what we gauge. So that's definitely one of the key metrics we look at. And then we do get a little, call it geeky, where we dive deep into some of those metrics of importance that are down the path, and that's around various mixed media models. We love to understand the impact of what our radio commercials that talk about Parkland Community Health Plan impact non-Parkland related search terminology on how to get help from Medicaid that drives somebody utilizing our website to find the information, resources they need, that ultimately leads to them enrolling in a Medicaid plan. So we love to look at that mixed media model to understand consumer behaviors in the path of awareness and selection. Carissa, is there things that come to mind from your organization on what metrics are really important?
Yeah, a couple things. So I guess the first one that I'll say is we define success based on how our customers are defining success. And what I love about working with you, Justin, and I mean the collective you specifically, but you as Parkland, is that we have such aligned missions. It's funny, when we were preparing for this, we recognized, Justin and I recognized that we both had a company history rooted in that Amazon kind of mentality, which is really a retail-like experience, knowing your customers really well, and also kind of being predictive in nature. And so I think the first thing is that, our metrics of success are ensuring that our customers are successful in the spaces that they want to be in. But because we're a SaaS company with a lot of kind of analytics backgrounds, looking for what is the next best action and doing a lot of that predictive modeling, we spend a lot of time from a data science perspective just understanding the accuracy of our models, and also really looking at how to iterate on those things and refine them and allow that refinement and that continuous learning to just make us better. And so we have a really lofty goal here. We have a slide that talks about correlation to causation. And having come from a background of being a social worker and being a care manager, we always, when reporting out, I was always able to talk about, well, we did A with this member and we got B response, but you could never really say that A caused B. And something that we really endeavor to do and look to do is to begin to get to that level of personalization where we're doing kind of some A/B testing and refining our model, that we can eventually get to a place of correlation. We know we did these two things and they're related, to getting to that one-to-one level of causation. Now, I can't claim that we've got that all figured out with a magic wand, but I think it's a really noble goal, and I think it's an important one. And it reminds me, Justin, of how you talk about abrasion, and we can't just let abrasion mean less. We can't just let this is correlation. You don't get to say that A equals B. Stop us from doing that important work of continuous learning. So really for me, it's about accuracy of the predictive models, flexibility to refine those models, and ultimately getting down to that sort of one-to-one level, such that you then, as the customer, are seeing the results that you want. You are seeing that more members are participating in those surveys because we communicated in the right modality at the right time, at the right cadence. And what you're getting back is that they're really happy with your plan and the way in which you interact with members. So lofty, yes, but important.
Thank you.
And I think we have some other questions.
We do. Our next question reads, I believe this is for Justin. It sounds like Parkland is doing a great job of taking a page from the retail playbook and delivering experiences that are data-driven and that mirror customers' growth expectations. What are the challenges of adopting this type of mindset?
Starts with the culture. I will say that for sure. And this has been something as an organization that, as we were building out, we're ensuring we're bringing on folks who are aligned in the mindset of wanting to make a difference in the community they live. We'll never be a national organization. That is not our plans, and nor would it be as a community hospital plan. But we can be the best in our area by knowing what our members' needs are, what our neighbors' needs are. And that type of thought process goes into everything we do in our organization. We considerably share stories about our members that come from various folks across the organization, community teams, our health services. Just throughout the course of going to our office, we run into members who are waiting in our lobby to ask questions, find help. As the Medicaid population that we serve, it's a huge need, right? You never really think about health insurance until you need it. And when you need it, it becomes a major item that you're looking for. So for us, it's all about sharing that at a cultural level and then embracing it across our actions. Sometimes you have a hard choice to make, and you always can ask yourself, what is in the best interest of our member here?
Thank you. We have other questions that have come in. As a reminder, go ahead and type your question into the Q&A box located on the right side of your screen and press enter. Our next question looks like it's for Carissa. It reads, how do you see health plans leveraging data analytics to really understand the member journey?
Good question. Coming from a non-IT data background, it's an interesting thing to think about. Healthcare feels really hyper personalized to me, and I'll admit that probably before I came here, that I don't know that I had a full appreciation for how important data is, and why it's so important. And so I think when I think about the member journey, and all of those various touch points, I think data really can augment all of your interactions. So one of the things that we started to talk about is this idea of looking at even all the way back to pre-member. So you have an individual who selected your health plan, and to kind of think about some of the things that Justin talked about from a mixed media perspective, using the data, leveraging the data to say what drew them to this plan. First of all, let's figure out, how did they find us? What made them want to kind of become part of this health plan family? And what does that mean? What is that telling us about this person? And then, okay, so they made that decision and now they're going to sign up for this plan. How did they do that? What communication modality did they choose? Did they meet with someone face to face? Did they call in? I think so often we can sometimes think more is more, and that's not always the case. So if we know that person X really prefers a high touch modality, face to face or a phone call, let's start there. That's a really great use of your telephonic FTE health plan resources. That is the person is telling you, I've called in, I enrolled over the phone. This is my communication preference. You can send me all the postcards in the world and you can print out all the pretty glossy brochures. That isn't what's going to drive my behavior. This interaction, that human interaction, is what's going to do that. So I think data really can inform strategies that help to avoid, to Justin's point, abrasion, while not just halting and saying, oh, we send too much mail, we make too many phone calls, let's just do less. Let's do more of the right thing and less of the interaction that is not desired. And then I think when members, consumers take the time and really engage with us and engage in their healthcare system and platform, it's on us. The onus is on us to really learn from that. When did you close a gap in care? What was that gap in care that you closed? What supplemental benefit did you use to get to that doctor's appointment, so that we as a plan, we as a vendor supporting a plan or a health system, ensure that we are providing more of what is needed. When we're designing our benefits, let's make sure that if we're seeing that our most vulnerable populations are really utilizing this transportation benefit, that's not where you cut costs. So I think there's a lot of great ways that we can leverage data throughout that process that allows for hyper personalization, and allows for an accurate and complete next best action that is what that individual wants.
Thank you. We do have another question that has come in. Looks like it's for maybe either one of you or both of you. What's ahead in the industry from both of your perspectives, and what can we look forward to?
Justin, do you want to take it first, and then I'll.
Yeah, I was thinking about that. It's a good question. So there's, I'll stay away from the path of artificial intelligence, wearable technology, this type of things, specifically to the industry that we work in. I think there's going to be some growth around the word access, in the sense that health insurance plans have always been looked at from a consumer perspective as an organization to pay claims. I go to the doctor, my health insurance covers me. Health insurance plans for many years have been wanting to do more than that. They want to be almost a care coordinator, care advisor. I still think it comes back to the simple terminology of access and how plans grow over time. I think the industry becomes more of an access industry. Look at some of the advancements we saw in telehealth over the past 2 years. I'm not sure about other plans exactly. I know from our perspective, we had maybe 1% of our membership February 2020 using telehealth. That changed in a 2-month period to 65% and has kind of held pretty strong since. That's an access thing. We're not a telehealth provider, but we provide that access to it. The use of resources and things that we talk about in the community, we're an access point to them. We are not an organization that is able to procure food and deliver food, but we can help connect those dots. So if I look at where the industry can continue to grow, it's around how we can further connect those dots, intersect those highways to ensure access to the core necessities that is healthcare. Carissa, from your perspective, what do you think's on the horizon?
Yeah, lots of stuff. I feel like I'm going to take the easy one here because it's what we've been hearing about so much over the last year or so. But to go back to this idea of the Amazon experience and the Netflix experience, I think member satisfaction is huge. So we've been talking a lot about Medicaid, but we know also that in the Medicare space, CMS is really looking at those CAHPS measures. So those measures of member satisfaction. They went from 1.5 weighted to 2 weighted, and now they're 4 weighted. And that to me is them really putting their money where their mouth is and saying, all right, it's gone are the days where we kind of throw the kitchen sink at folks to make sure we close gaps in care or we reduce care costs. We need to do that, but we need to do that in a way in which is not abrasive to our membership and that is satisfying to them. So, we know there's more plans out there. There's so much more choice. And so satisfaction is going to be a big part of that. I think people are going to be looking at purchasing their health plans or selecting their health plans the way in which they do any other good or service. Like you would buying a car, you're going to take a look and really line those things up. And if you're not having a good experience with that plan, you're going to make a shift. And so I think this is becoming a very consumer-driven industry. And what will be interesting to see going forward is how do we do that in a very real and meaningful way. And I guess what I mean by that is not teaching to the test. I think about what we're doing in that CAHPS perspective. That survey is one piece of the pie. It is the letter of the law. It is how did people answer questions about access to care, and only about 30% are doing that. I think it's going to be very important to focus on the spirit of the law. So the reason why we're weighting things like CAHPS is because at the end of the day, we want to drive a good member experience. So it is not something whereby we can just kind of teach to the test. So I think there's a lot of things that are going to go into that that have a whole lot of far-reaching implications, whether that be, to your point, an access to care perspective. We have a lot of plans have utilization management in place, and there's probably really great initiatives in place to help kind of drive the right care at the right time and keep costs down. But where do those things become access to care barriers? Such that suddenly your member satisfaction is really reduced. And guess what? Your provider satisfaction is too. So I think that this idea of taking all the good work that has been happening to close gaps in care and to ensure people are getting the right access to care at the right time in the right setting, now we're looking to make sure, are we doing that in a way that is keeping our consumers, our members, our patients, whatever we call them, that is keeping them satisfied and happy too. So I think that's a big part of what's to come. And what I'm happy to say is that I think it's going to be a big part of what continues to come. And that makes me excited to be in the healthcare industry.
Well, thank you. Thank you both for that great presentation and for sharing your thoughts. We thank the audience for participating in today's webinar. This concludes today's presentation. We thank you again and enjoy the rest of your day.